Hi, this is Dr. Gil Wilshire, Missouri Fertility in Columbia, Missouri. Today we're doing surgery at Boone Hospital Center. Our patient is a 31-year-old woman who's been having very heavy, crampy periods that are only getting worse. This is called dysmenorrhea and menorrhagia. On ultrasound, we found that she had a very large fibroid in her uterus, and it was very close to the lining of her uterus, which was causing this abnormal bleeding. She's 31, she's never had children, and she wanted her uterus preserved. Now, uterine fibroids are the #1 cause of hysterectomies, and about 300,000 are done in the United States every year. This woman wanted to keep her uterus, so she came to us for fertility-preserving surgery. The first thing we did earlier in the surgery was to put a telescope in her uterus. That's called a hysteroscopy. We fixed some little polyps and things on the inside of her cavity, and we saw this fibroid bulging into the cavity with thick, dilated veins. That was the reason she was having abnormal bleeding. Now, usually we'll then go above to the abdomen and do a laparoscopy, make some tiny holes, put in a telescope, and take out the fibroid that way. In this case, however, the fibroid was very, very close to the cavity, and it required what we call microdissection to get the fibroid off of the cavity without injuring it. Thank goodness we've been able to do that, and I want to show you the results of our surgery here halfway through. We've made a small bikini cut in her abdomen, and we're now going to show you her uterus where the fibroid has been taken out and the cavity of her uterus has not been compromised or entered. So if we swing into the abdomen here, here's the patient's uterus, here's the incision we made, and right here is the lining of her uterus called the endometrium. It's still intact, we've not made a hole in it. We're going to sew this together now. Put the uterus back together with the absorbable sutures. It will heal beautifully and her fertility will be restored. At the same time, we check out her right tube and ovary, which are normal, her left tube and ovary, which are normal. We've checked her appendix, her kidneys, we've checked everything out. There's no endometriosis. This uterus should heal beautifully. In about 3 or 4 months, she should be able to become pregnant, and hopefully her abnormal bleeding will be essentially cured. So that's an open approach to a uterine myomectomy with microdissection off the endometrial cavity layer. I hope you found that interesting. Dr. Wilshire, Missouri Fertility.